more about resistance, I want to make one important correction here. So go back to that first diagram that we drew, this one. Okay, I think I accidentally swapped these two values, right? The veins are going to have the lower pressure, so make sure you have 2 millimeters of mercury here. And this is actually the CVP. So this is a vein, so it's central venous pressure, so this labeling is not right, okay? Also, on this side, there should be 16, which is the higher pressure in the artery, and then this becomes the mean arterial pressure and not the central venous pressure. Okay, so just make sure you have that correctly. So the pulmonary artery has the higher pressure, right? It's leaving the heart, and that is a mean arterial pressure. The pulmonary vein has the lower pressure. That's how we get our gradient. And that's going to be found by the CVP, the central venous pressure. And then this will be your CVP. And this down here in the aorta will be your mean arterial pressure. So just make sure that that is labeled correctly. Okay. Also on this second drawing we did here, or chart, so make sure that you don't have brackets. I accidentally put brackets here. We're only raising the radius to the 4th power. Okay, when we rearrange that equation, only the radius is to the 4th power. And on this note, guys, I don't want you to be too concerned or too nervous about algebra. I'm not going to ask you to memorize any complicated formulas. I'm not going to ask you to do anything that needs a calculator on an exam. You may be asked to rearrange the formula, and I'll talk about some examples of how we do that. And we'll look at some questions that'll get you used to what type of question you can expect. But don't get too nervous about memorizing anything. This is not an algebra course. This is basically just walking you through how we derive these relationships. And I'm really, this is the more important thing that I want you to focus on, these two relationships. And this is the process of how we get there, okay? So make sure you understand how bulk flow relates to pressure and radius, and then how bulk flow relates to viscosity and length. Yep, Madeline? No, there's no parenthesis here. There's no parenthesis. So to scratch out the parenthesis, it's pressure times radius to the 4, times pi radius to the 4. Okay? I hope that makes sense. Any other questions? Okay, so let's move on. So we left off looking at resistance, and we talked about the factors that affect resistance. We're also going to look at the arteries and arterioles. So the arteries and arterioles are the areas in our vasculature that have the ability to regulate their radius very heavily. So we can see two different phenomena in the arteries and arterioles. The first one is vasoconstriction. And this is the ability of an artery or arteriole to decrease its radius and therefore increase its resistance, okay? We know that in our vessels, there is smooth muscle, and there is more smooth muscle in arteries and arterioles. They have a thicker lining. We're going to talk about that going forward. And the presence of this smooth muscle is where we have that regulation of the radius, okay? If we let that smooth muscle contract, we're going to decrease the radius. If we let that smooth muscle relax, we're going to increase the radius. So vasodilation is decreasing the radius, which increases the resistance. And then vasoconstriction is decreasing the radius and increasing the resistance. And vasodilation is the opposite, okay? We're going to increase the radius, which decreases the resistance, all right? And we already mentioned this phenomenon here below. The pulmonary circuit has much less resistance, partly because the vessels are shorter length and they have less of a ways to go. And we know resistance is affected by the length as one of those variables. Okay, the last thing we'll wrap up here by looking at is the total peripheral resistance. And this is basically the sum total of all the resistance that's found throughout the vasculature. So when we look at resistance, we can see different resistance in different vessels. But the TPR takes account all of the resistance that's encountered across the entire vasculature. It's a value that we're going to look at a lot over the course of the next few lectures. together with mean arterial pressure and central venous pressure. And so I want you to understand that it's not looking at one vessel versus the other, but all of the resistance as a whole that's encountered across all of the systemic circulation, or we can look at the TPR for the pulmonary circulation by itself as well. Okay, and let's just look at the relationship here once again. So if we have vasoconstriction in the network, right, as a whole, when we talk about TPR, we're looking at the entire circuit. We will have increased resistance across the entire circuit and therefore decreased flow across the entire circuit, okay? And on the opposite end, if we have vasodilation in the network, again, the entire network, we have decreased resistance and increased flow. So the same properties that hold for a single vessel will hold for the entire circuit, and that is where, that's what we look at when we look at TPR. All right, now the last thing here is to relate these physical parameters that we've been speaking about. So far we talked about flow, we talked about pressure, we talked about resistance, and we want to relate these terms to actual values in our body. So we know that flow is synonymous to our cardiac output, right? It's the overall driving force of moving blood through our systemic circulation. Last semester, we looked at cardiac output. Does anyone remember the formula we said for cardiac output? Does anyone remember the formula for cardiac output? I think I'm hearing it. Stroke volume times heart rate. Yeah, stroke volume times heart rate. So just like flow, it's going to be a rate. And we said that that value is something like about 5 liters per minute, right, in terms of our cardiac output. So flow is it's the same thing as our cardiac output. And as we go on to talk about our actual human physiology, I want you to think about cardiac output as a measurement of flow, okay? Likewise, pressure is a measurement of our mean arterial pressure. We kind of made this connection already. So as we go on, we'll talk a lot about mean arterial pressure. And in your mind, you should be thinking about the pressure gradient, right? The driving force, right? Pressure gradient, i.e. mean arterial pressure, is the driving force for our circulation. If we don't have mean arterial pressure, we don't have circulation, okay? And then R is the same thing as our total peripheral resistance, which we just made that connection, okay? The entire resistance that is encountered across all of our vasculature. So if you look at this formula, we can then deduce this formula at the bottom down here, that cardiac output is equal to mean arterial pressure, which is our driving force, divided by the total sum of the resistance